The most common question that any patient has once being advised cataract surgery is that will I have to wear glasses after my cataract surgery is done? I hope all my number goes away after cataract surgery. I've heard about so many lenses, so many good things, so many bad things. Which is the lens which is best suited for my eye and so on. So let's try and understand some of the basics of the different types of intraocular lens options that one has today in today's medical science. So grossly, there are three basic kinds of lenses. One which we call as monofocal. So monofocal means a single focus. So whenever we plan a monofocal lens, we try in such a way that we try and correct as much as possible of the distance number as much as can be done. And for intermediate to near, most individuals will have to wear glasses ranging from 2, 2.5, 3 or progressive glasses or bifocal glasses. It's not as if the number for distance becomes perfectly zero for everyone. If we measure in every eye, there is always some residual number left behind. But majority individuals after both eye surgeries done tell us that most of their distance visual acuities are corrected without the need for or dependence for glasses at all activities. So the actual type of lens which would be best suited to your particular eye, we come to know together after a detailed preoperative evaluation and thorough discussion with the patients.